Hello, I'm Richard Kaner, Director of Treatment and founder of Brooklyn Audiology Associates.
And I'm Dr. Max Rubin, audiologist and co-owner. Welcome to Brooklyn Audiology Associates. Please watch the following video message from our colleague, Dr. Keith Darrow.
Stay tuned through to the end for an important message from us and how to get a free copy of my co-authored book.
Hi, I'm Dr. Darrow, and I want to take a few minutes to explain how exactly we help nearly 80% of our patients reduce their experience of tinnitus. For starters, the very first question I always get from people is, do we say tinnitus or tinnitus? Good news, either way is correct. So either way is fine. Before I dive into how we treat tinnitus and how 80% of our patients experience significant relief from their tinnitus, for many, it can actually go away. But we first have to talk about the why. Why do people get tinnitus, and why is it so important to treat tinnitus? So let's start by all agreeing that there are many forms of tinnitus. What I mean is, there are many reasons that nearly 50 million Americans live with annoying phantom sounds in their ears or in their heads. Interestingly, no two people have the same tinnitus. You know, for some, it's a ringing. For others, it's a buzzing, it's pulsing, it's chirping, it's crickets, it's swooshing. I mean, I've heard nearly every adjective for the tinnitus. Now, it is really important that you hone in on that keyword that I just used, phantom sound. You see, that's actually the definition of tinnitus, and really important to understanding what tinnitus is, which I'll come back to in a couple of minutes. So, look, while some people may find that their tinnitus is directly related to maybe their health, could be related to stress or diet, even jaw-related problems, let's be honest with each other. The vast, overwhelming majority, I'm talking over 90% of people with tinnitus, which means most likely you too, experience these phantom sounds as a direct result of damage to the auditory system. Now notice, I did not say hearing loss because there are plenty of people who have tinnitus and they've yet to experience significant hearing loss. Again, at least not yet. You see, the number one risk factor for experiencing tinnitus is, well, the number of birthdays you've had. That's right. The older you are, the more likely you are to experience tinnitus. Now, mix in with your age, maybe some of those loud concerts or weddings you attended, perhaps throw in some medications that can be bad for the ear. Well, now you got yourself a one-way ticket to experiencing those annoying phantom sounds. Well, at least it's one way if you don't get the right treatment. Tinnitus or phantom sounds are the direct results of the nerves breaking down from your ear to brain. You see, as we get older, there's a natural loss of these connections to the brain. And since the brain is activated by these sound nerves 24/7, since the day you were born, actually, even before you were born, the brain gets all out of whack when the nerves get damaged. So I hope that makes sense. But now let's go back to that word, phantom sounds. You see, the reason we use that word is because, from a neurology point of view, the experience of phantom limb, which I'm sure you've heard of, and phantom sounds are the exact same neural phenomena. So let's take a person who's experienced the loss of a limb. Maybe it's from an accident, maybe they're a wounded soldier. The reason that they can still feel the lost limb is that the brain says, hey, I've been feeling sensation from this limb my whole life. And even though the nerves are disconnected from that limb to the brain says, I can still feel this missing limb. Thus the term phantom limb. Now, when it comes to tinnitus, because our brain is always stimulated by sound, even when you sleep, when the nerves come undone from the ear to brain, because of age and all of our life experiences, well, the brain says, I'm used to hearing these sounds, so I'm going to make up for it. And voila. The sounds that aren't really there now become audible because your brain is making these phantom sounds. So I hope that that explanation will make some sense to you. Now, here is why it's important that tinnitus be addressed at first notice. You see, most people will tell you, yeah, I hear some ringing in my ears, but only at night or only when it's really quiet. Well, consider this your internal alarm telling you something is wrong. Right? The alarm's going off. It's also telling you that you need to do something about it. The truth is, when left untreated, tinnitus will only get worse and it will become more bothersome. If you look at all the data and just ask people who experience tinnitus, over 55% of people with tinnitus, they actually categorize it as being bothersome and interfering with their life. I have to be honest with you. Once tinnitus gets bothersome, that simply means there's a ton of damage. And when it comes to any major medical condition, the prognosis is always the same. Catch it early and treat it early for the best results. Which brings us to how we effectively treat tinnitus. Now, I'm not going to bore you with all the juicy medical research details. But if you look at the medical papers and review the approved protocols for medically treating tinnitus, you will see what treatments are not effective and those that are effective. I'm not talking about just doing a Google search. I'm talking about looking at medical literature. First, let me tell you what does not work. Surgery, medicine, supplements and vitamins, shocking the brain, these are all explicitly not recommended to treat tinnitus. A step above is cognitive therapy, also called talk therapy. It's only recommended to help relieving the stress, right? The mental anguish that can come with tinnitus. But please note, this type of therapeutic intervention does not provide direct actual relief of the tinnitus. It more just treats the side effects of experiencing tinnitus. I bet you're wondering about sound generators too, because lots of people will say, well, I have a noisemaker, or I sleep with my TV on at night, to like drown out the tinnitus. Well, this form of passive treatment, sometimes called indirect treatment, truly does nothing to help with tinnitus. Rather, it simply distracts the brain so that you don't hear it as much. But it's not actually treating it. So finally, when you look at the data and the clinical recommendations, in the past decade, there have been 34 independent, blinded studies that looked at the use of hearing aid technology to address tinnitus. And guess how many of them were found to A, reduce the actual tinnitus, and B, reduce the impact of the annoying tinnitus? You guessed it, 100%. In 100% of studies in the past decade, we have discovered that the most effective way to treat tinnitus is to provide direct sound stimulation to the brain. You see, what direct, sometimes called active treatment, can do is actually allow the brain to rewire. You know the fancy word, neuroplasticity. What this does is it helps the brain make long-term neural changes, which means you will hear much less tinnitus. For some patients, the tinnitus can actually go away. As a matter of fact, we recently completed our own multi-site research project with hundreds of patients from across the country. The data was so impressive, we recently presented this at a conference. Imagine this, in nearly 8 out of 10 patients, that's 80% of patients, experienced direct relief from their tinnitus. What this meant was that they A, slept better, B, were able to focus and concentrate better at work and at home, C, they were less anxious and less stressed because of the tinnitus, and D, of course, they all heard better because there was less distraction from the tinnitus. Frankly, I've yet to meet a person with tinnitus who does not want all of these things. Now, let's go back to why this treatment is so important. While I just laid out for you the exact results that you can expect when seeking treatment in our centers, if you dig a little bit deeper, because tinnitus is most often the result of damage to the auditory system, what this really means is that your tinnitus is a precursor for what's about to come. Some of you might know what I mean, which is first comes the tinnitus, and then comes the embarrassing hearing loss. And both tinnitus and hearing loss can increase your risk of falling, increase your risk of losing your home, becoming hospitalized, and even significantly increase your chances of developing dementia. Which is why we recommend to all of our patients to seek treatment for tinnitus, even at the earliest signs of noticing it. So while there is no cure for tinnitus, just like there is no cure for most major medical conditions, like cancer or heart disease and so many more, there are incredibly effective treatments that can help so many people, perhaps even help you. And these treatments are shown to not only reduce the tinnitus, but they can help you to maintain confidence. They can help you to stay in your home longer, help to reduce your risk of dementia, and help you to stay passionately independent as you age. I hope you will take the time to reach out to one of our Excellence in Audiology centers across this great country to receive the treatment that you need to hear your best and to hear much less tinnitus.
Hi, I'm Richard Kaner, and this is Dr. Max Rubin.
Thank you very much for watching that very important message. And welcome again to Brooklyn Audiology Associates.
When I started this practice in 1980, it was founded on the core principle to treat every hearing loss, its debilitating symptoms, and the cognitive aspects associated with hearing loss to the very best of my ability. Here at Brooklyn Audiology, through over 4 decades of research and case studies, we have developed a proven process for making you hear the best you possibly can.
With the appropriate treatment, you will not only hear better, but we can help reduce your risk of the hearing loss getting worse and reduce your risk for cognitive decline. Rich and I, along with all our providers and staff, will help guide you on your journey to better hearing.
Thank you for trusting us for all your hearing healthcare needs for over 40 years.